Hi student again, this is Miss Tshabalala. We're still doing topic 3 but lesson 4. So the module, remember, I have divided into two because in fact the units, because it is a very long unit. So we had 3.3.1 units, now we are having 3.3.2 units. So we are still on subject outcome 1, know and understand HIV, AIDS, and STI and opportunistic infections. Then there are 5 learning outcomes that we will do. Number 1, explain the modes of transmission for HIV and STIs, ways in which HIV is passed on, identify opportunistic infections and how they occur, with special reference to TB, tuberculosis. Number 4, explain how HIV and AIDS and opportunistic diseases can be prevented. The last learning outcome is to identify available health-related support services and how they can be accessed. Remember, it's not only a department, certain department like Department of Health, that you can go and look for help. There are many organizations that deal with HIV issues, so that you can also go to, but we'll learn about that later. And then transmission for HIV and STIs. Mode of transmission is the way an infection is spread or carried from one person to another. Remember, some people, they like to speculate that HIV originated from monkeys from America. You can also Google where HIV was originated, just like we know where COVID-19 started. So you can also Google and get the information. And then STIs, sexually transmitted infections, are passed on through sexual contact, e.g. sexual intercourse, kissing, oral genital contact. The example of STIs are genital herpes, genital warts, gonorrhea, chlamydia, syphilis, hepatitis B. There are so many. So you can also go on your Google, type STI examples, and if you are sensitive, please rather do it online with a friend. Remember to keep a social distance, it's very important. So if you are sensitive, don't Google these STI examples and watch them alone. So some are very, very bad. Then let us look at the transmission again for HIV and STI. STI can be transmitted into 2 ways during sexual contact. 1, through mucous membranes. When infected, semen or vaginal fluids contact mucosal surfaces like the male urethra and female vagina, like HIV, gonorrhea, chlamydia. That's how it can be transmitted. Number 2, by skin-to-skin infection, transmitted through contact with infected skin or mucosal surfaces, e.g. a genital herpes, syphilis, human papilloma. Oh, human papilloma, yo, I've seen it. It's very dangerous. I remember there was one time where we were looking at this STI example, the human papillon. Someone almost vomited. So if you are sensitive, then remember to watch them with a friend that you trust, and you must keep a social distancing. Then there are ways in which HIV is passed on: through sharing needles, razors, toothbrushes with an infected person. Now remember, HIV is always looking for an entry point. Secondly, by having unprotected sex, not using a condom with an infected person. So it's very important to know your partner's status, and it's advisable that when you engage yourself in sexual activities, please take your partner and go to Department of Health and do testing. Even at college campuses, a higher health is always there to support students on HIV and AIDS issues. So you can also get HIV by touching an infected blood. So it's very important that if someone is bleeding, make sure that you wear protective gloves so that you don't get infected. So even if you don't know the status of that person, so rather be safe than be sorry. Not that you must discriminate. Give support, help where you can, but also be careful. So also babies born to HIV positive mothers may be infected before or during birth or from their mother's breast milk, because some mothers they mix solid food with a breast milk. So if you only do breast milk, that breast milk can be passed through urine or stools. But the problem is, remember, HIV is looking for an entry point. So once they are cut due to solid food, maybe a child his mouth sores, then that's where the child will be infected. Or if a mother gives birth to the child and without informing a health workers about her status. And then let us identify opportunistic infections and how they occur with special reference to TB. Opportunistic diseases are infections that take advantage of a weak or ill body. If your immune system is strong and working properly, it is easier to fight and control germs and illnesses. But when your immune system gets weak, it causes serious diseases such as TB, pneumonia. There are so many diseases that can be caused due to weak immune system. For an example of common opportunistic diseases, thrush, genital herpes, pneumonia, TB. There are so many. You can also Google them. So the things that weakens immune system, people, they tend to abuse alcohol, drugs, HIV, and AIDS. That can also weaken your immune system, and malnutrition and diabetic and other chronic diseases. So if you don't eat a healthy balance of food, and then it's where you weaken your immune system. So it's very important that even if you are HIV and AIDS, then you take care of yourself. You eat healthy, you avoid stress, you protect yourself when you engage in sexual activities. So you stay positive all the time, and you also take treatment if it's needed. Remember now, there's this 1990 where people are encouraged to know their statuses, to get tested, to take a treatment so that the viral load can be suppressed. Then let us identify opportunistic infections and how they occur with special reference to TB. TB, tuberculosis, we remember we talked about it on the previous lesson. It is very dangerous, but it is curable and treatable, unlike HIV. Look at the diagram on page 123 from your textbook. Opportunistic infections that affect the brain, lungs, skin, mucous membrane, you will see that so through the diagram. Then tuberculosis is a very, very dangerous opportunistic infection like I've mentioned. Let us look at the symptoms. A recurring cough that lasts more than 3 weeks, meaning you cough constantly more than 3 weeks, then you must visit the nearest a health department. Blood in your spit when you cough, so it's another sign. The fever that seems to come and go, night sweats, pain in your chest, tiredness, loss of weight and appetite. These are the signs that you mustn't ignore, so that you can get the treatment quickly and it can be cured. Transmission of TB. TB is cured by bacterium, Mycobacterium tuberculosis. It affects lungs, although other organs can be affected, but mostly lungs. It is mostly spreading through the air from one person to another, just like COVID-19. It happens when a person with TB coughs, spits, or sneezes. Exactly. So droplets of air with the TB bacteria can be breathed in by others. So you see how dangerous it is. So that's why nowadays everybody, once you leave your house, you have to wear the face mask to protect other people from a COVID-19. Transmission of TB is almost the same as COVID-19 coronavirus. So I did mention that. Again, I'm still repeating that we still need to, even if you trust your friend, but always wear your mask. TB prevention and treatment and cure. How can we prevent TB? Remember, just like COVID-19 again, fresh air is needed, so keep windows open for a good ventilation. Cover your mouth when you cough. TB is treatable, curable, and preventable. Once you start taking treatment, complete it, because once you lapse, it becomes difficult to cure once you lapse from your treatment. TB treatment can be taken up to 6 months. So I want you to do activity that is on page 121, activity 11, to investigate TB. So these pictures, I'm trying to arouse your interest, that you must take a treatment about TB, a patient. So if you go to Department of Health website, you'll see a lot of information about TB, or if you just Google about TB prevention, transmission, cure, etc., you'll get a lot of information. I know you use your phones, your smartphones, to do a lot of things. So if you don't have a smartphone, it's fine. You can use your PC. Remember, life orientation, we are mixing theory and life orientation. You can get the time, maybe 5 minutes before you leave the class, just to Google some stuff that we learn from the theory section. Explain how HIV and AIDS and opportunistic infections can be prevented. Ways to prevent HIV. One is very important, as you are still a students, so you must focus on getting your certificates and diplomas and further education. So abstain from sex if you can. If you can't, use your condom when you have any intercourse. It can be vaginal, anal, or oral sex. We know there are so many types of intercourses, sexual intercourses, so we know very well. Test before you enter into any new sexual relationship. Make sure that your partner goes for testing too. It's advisable that if your partner really cares for you and loves you, you go together. Be faithful to one partner. Don't sleep around. Don't have multiple partners. Avoid having sex with strangers. Do not share razor blades, toothbrushes, or inject drugs. Always wear protective gloves if you help somebody who is bleeding. Remember, there's no need for you to say, this is my mom, this is my child, this is my sister, and I don't know the status. And then, yes, you need to help, but please be careful, be safe, wear protective gloves. Identify available health-related support services and how they can be accessed. If you get sick, go to Department of Health, visit any nearest clinic, contact HIV and AIDS helpline, live centers, a treatment action campaign, TAC, TP centers, SANTA, South African National Tuberculosis Association, and you can also visit Department of Health website. It's http://www dot, not comma, dot doh.gov.za. I'm sorry about that typing area. Let's hope it will be clear, and then let us summarize. So remember that I'm using exam preparation questions. Some I get it from your textbooks, some I create them. And please make sure that you do all the case studies, because case studies are very important even for exam. So and then I have created 5 questions, taking questions from TB, and then I also did enrichment questions for COVID-19. What is TB? You must give me that answer. Remember, I did explain how it is passed on, what are the symptoms of TB, how TB is transmitted, and you must explain 3 ways on how TB can be prevented. Number 6, explain how HIV and AIDS opportunistic infection can also be prevented. Identify 4 health related support services for HIV, TB, STI. So, and also for COVID-19, that is for enrichment. It's not examinable, but in future maybe COVID-19 will be included, because it has affected a lot of people worldwide. So I want you to do these questions, please. They're gonna help you know and understand what is TB versus what is COVID, and how TB is passed, how COVID is passed, what are the symptoms of TB, what are the symptoms of COVID, how it is transmitted and how COVID is transmitted, and explain how COVID-19 can be prevented, same as how TB can be prevented. Thank you so much, students. I'm wishing you all the best. See you when we do the last lesson, lesson number 5. Thank you.